Good morning. I'd like to start by giving you the context in which the current Community Health Assessment, or CHA, has been developed. That requires going back several years. The Southern Nevada Health District applied for and received a small grant to begin pursuing public health accreditation back in 2011. Two of the key requirements for accreditation, developing a CHA and a CHIP, are collaborative processes that involve community partner agencies and members of the community. To be done well, they need to be developed through a structured process. A number of models, proven models exist for developing CHAs and CHIPs, and in 2011, as Dr. Iser mentioned, the Mobilizing Action through Planning and Partnerships, or MAP process, was selected. The first element to be developed by using the MAP process was the Community Health Assessment, or CHA. The CHA is a report of objective and consumer data representing the health of Clark County residents, which is then used to guide the development of a CHIP. The four assessments comprising the CHA are the Community Health Status Assessment, which is the compilation of objective community health data. It contains many graphs, charts, and tables depicting how Clark County is doing in various health-related areas. Depending on what types of data are available, it can include trends over time, comparisons with U.S. averages or peer counties, and comparisons with benchmarks such as Healthy People 2010 or 2020 goals. The next assessment is the Local Public Health System Assessment, which relates to the components, activities, competencies, and capacities of our local public health system and how essential public health services are provided to the community. The Community Themes and Strengths Assessment describes the issues that residents feel are important. And the fourth assessment is the Forces of Change Assessment. It looks at things happening around us that are most likely to influence our community's health, both positively and negatively. The Community Health Status Assessment contains objective measures, and the other three assessments contain objective and consumer data. As most of you are probably aware, the Health District experienced disruption of operations in the spring of 2012 due to the unplanned closure of the Shadow Lane campus and the subsequent move to the Health District's current location on Valley View Boulevard. Further MAP activities with community partners and the compilation of the four MAP assessments into a CHA were put on hold. However, that was just a temporary pause. In 2014, the Health District resumed the process of public health accreditation and the reconvening of community partners to participate in the MAP process. A steering committee was formed consisting of various members of the public health community, many of whom are here today, and work resumed on developing the four CHA assessments. Upon review of the 2012 efforts, two of the MAP assessments, the Local Public Health System Assessment and the Community Themes and Strengths Assessment, were deemed to be still relevant. The Forces of Change Assessment was recently updated to take into account the most current forces affecting community health. Most of the contents of the Community Health Status Assessment had become stale and needed updating. Rather than simply updating the data included in the 2012 Community Health Status Assessment and report, we gave more thought to which data to include and how best to present the data. As of now, all of the data have been collected and analyzed, meaning that the Community Health Status Assessment has been done. However, the full CHA report is still being updated. Although the CHA report is still in draft form, we believe it contains essentially all of the data that will comprise its final version to be published later this year. With the CHA assessments complete, it was time to start identifying the community health priorities. The steering committee reviewed the CHA draft report and worked together with the team that compiled the CHA data to identify 7 proposed priority issues affecting the health of the Southern Nevada community, along with 4 overarching core values. These priorities are being shared with you today at this first Community Health Improvement Plan, or as you know, CHIP, team meeting for your consideration during the process of developing the CHIP. To be selected as priorities, issues had to be deemed important in at least 2 of the 4 MAP assessments. While importance is somewhat subjective, selection was based on objective measures such as how many people are affected by the issue and whether a particular segment of the population is affected disproportionately, what are the personal or societal costs of the issue, how much the issue affects length or quality of life, how feasible it would be to apply and measure interventions to address the issue, and how well or poorly Southern Nevadans fare compared with national averages, benchmarks, or targets on the issue. After digesting the information in the CHA with those thoughts in mind, the steering committee agreed on the following 7 health status and system level priorities. These will be listed in no particular order of priority. Determining the top priorities will be your job. 4 of the issues are health status priorities. Chronic disease, which was based on these being the top causes of death and illness throughout life. Injury, specifically suicide and drug poisoning, which are 2 issues where Clark County residents fare worse than the national averages, and because the rates have been increasing. Maternal and child health, which is based on the fact that negative maternal and child health outcomes often result in lifelong health and societal disadvantages for children and sometimes for their mothers, and because Clark County residents fare poorly on certain maternal child health measures like low birth weight compared with US benchmarks. Influenza and pneumonia, based on Clark County residents having higher rates of influenza and pneumonia-related deaths, and on the facts that these are vaccine-preventable diseases and our residents are under-vaccinated. The rest of the 7 priority areas are system-level priorities. I probably don't need to elaborate much on these as they're commonly understood as being issues in the state of Nevada. And they are access to health care, public health policy and funding, or lack thereof, quality and continuity of health care. I should reemphasize that these are community-wide priorities that can be addressed by numerous community partners. They're not specific to the health district nor to any agency or organization in Clark County, although all of us should be considering these priorities as we develop our respective strategic plans in the near future. I mentioned that there are also 4 overarching issues or core values that the steering committee identified as being important. They felt that these should be taken into consideration regardless of which priority issue is being addressed. These are health equity, or addressing disparity in health issues, increasing partnerships and collaboration among local public health system partners, meaning those of us in the room today as well as others, improving data sources and the monitoring and assessment of health issues, assessment and monitoring of, and incorporating the concept of complete communities or built environment into policies and interventions. As we move forward in this meeting, giving you more information about the 7 priority issues, please keep in mind that your task today will be to score each of these priorities as the first step towards selecting which ones to include in the CHIP process. Thank you. Now I'll turn this back over to Lynn Lewis.